We're joined in this portion of our program by Jennie Kramer. Jennie is the founder and executive director of Metro Behavioral Health Associates Eating Disorder Treatment Centers. She is joining us on our program to talk with us about some of the information that is contained in Overcoming Binge Eating for Dummies. Yes, a book from the For Dummies series. And we've got some very interesting and very serious topics to discuss in this discussion. Jennie, it's nice to have you join us on our program.
Oh, thanks so much for having me.
This idea of binge eating disorder, what exactly is involved in that?
Well, it's a great question because I think many people think binge eating is something different than what it is.
Mm-hmm.
If, let's say, you are feeling upset or you are nervous about something and you notice that you're eating excessively, sort of in an episodic way, and you kind of have an awareness that you're doing that, you're not sure why you're doing it, but you can't stop yourself from doing it, but it's not all the time, that's something we tend to call emotional eating. And it certainly can be serious, but it's not quite what binge eating is. On the other hand, if you're someone who just sort of grazes all day, no hunger cues, no satiety cues, you're just kind of eating all the time, and when you sit down to a meal, you have very, very large portions, and whatever portion someone gives you seems to be the right portion. That's also overeating, but we tend to call that compulsive overeating. Binge eating, by contrast, can include all of what I just said, but mostly what happens is it's very, very voluminous amounts of calories in a sitting. It's usually multiple times per day, evening, or week. And it's to the point where the only thing that stops it is either falling asleep or feeling physically ill, because it's just such an intake of calories that the body can barely stand, for such a discrete period of time. And it often happens in secret, with a lot of shame, not in front of other people.
Does it happen to people from all age groups in our society?
Unfortunately, yes. What we're finding in research over the last at least 10 years is that this used to be just more females, more adult females, although that's still a major part of the population. It can happen, believe it or not, to adolescents. It can happen a lot more than we thought to boys and men. So it's really reaching across the barriers, I would say.
And when we see that kind of change or trend happening, what do we point to as reasons for that?
Well, I think it's multifactorial. I mean, first of all, I don't think that men are suddenly binge eating. I think they're suddenly coming forward and saying, I may not be able to handle this by myself. And by the way, I didn't know there were other men that were suffering from this. I thought it was just me. The second thing is we can point to things like, believe it or not, electronic media. Now, I'm not blaming electronic media. I have an iPhone. I do everything everybody else does. It's just to keep up. But imagine some of the brain changes that must be occurring from the immediate information that we all must get and have all the time. And so it doesn't surprise me that there's an increase in binge eating. It doesn't surprise me there's an increase in ADD, because literally our brains are expecting something all the time and very quickly and right now. And that's just, a part of it. In addition, there are those that would also say our food chain has been interrupted. There are additives in foods that actually promote hunger. Certainly many more foods are sugar-laden if you're not careful and you're not reading the labels. So I think there's a lot of factors, but that's just a handful.
And when we try to take kind of a gauge internally of what we're doing, what our real approach is to food, do you find that people sometimes are almost not conscious of the way it is that they're approaching food and approaching eating?
I think that's a brilliant observation. That's true in many cases. I mean, even people who don't have what we'll call a form of disordered eating, A lot of people just sort of eat as a thing on their list of things that they have to get done today because they're doing 4 other things while they're eating. And so there is an unconscious process to it. It's sort of, not something they're focusing on. With binge eating, it goes a degree further in that it's something we call dissociative eating, which means that when we interview binge eaters who finally come for help, and we ask them, so tell us, what do you eat in a day? If we went by what was on what they tell us, we would not be able to understand how they could possibly consider themselves binge eaters or even be overweight. Not that all binge eaters are overweight. But when we then do a guided a tour of what they're really eating and take them through it, even they're shocked at how much they're eating because they don't realize it. They're not paying attention. It's that dissociative.
In the age in which we live, one would automatically think that's highly possible because people are very often so fixed on what that next thing is that they've got to get to that they really are not, quote-unquote, present a good deal of the time. And I'm assuming that just applies. I mean, food and eating, that's not going to be an exception to that. That's just going to be yet another thing people aren't present for.
I agree. And let's not also forget that food is really so full of meaning for people. For some people. For some people, you notice there's like this 1 in 100 that just sort of, eats to live just because like they have to, and so they do. And, there are people that are jealous of those people. But mostly, food has a lot of meaning for people. It has cultural attachments, certainly family attachments. If you ask people about memories of their childhood, 70% of the time they're food-based. So it's impactful. When you think of the very, very first thing that a baby does when it is born, it is suckling. And so it's so primal that it really makes sense when you think about it that it's going to become one of the ways that we tend to self-soothe. So if eating is something that's that primal and that basic, and you are somebody who is suffering from depression, anxiety, perhaps even trauma, it makes sense that you might want something that's familiar in order to help you self-soothe. Now, there are people who turn to things like drugs, alcohol, other addictions. My position on the abuse of food, be it through binge eating, anorexia, or bulimia for that matter, is that it too is an addiction. Now, with drugs and alcohol, you're addicted to a substance or more, and so you have to get that out of your system. But if that's all there was, wouldn't everybody be cured after 28 days of rehab? You'll notice they're not, because what they're also addicted to is the behavior. They're addicted to the habit of the behavior, and it's very, very difficult to give up. So we treat binge eating and all other forms of eating disorders as if they are addictive because neurobiologically the pleasure centers of the brain are still stimulated all the time. And I think it's the most difficult addiction because you can give up alcohol forever, you can give up drugs forever, you must have a relationship with food for the rest of your life.
This whole idea of the hunger and fulfillment signals that we get or think we're getting from our bodies. How off can we be at times in our perceptions of those?
Completely off. Really off. I mean, one of the things that we do, one of the first steps in helping people is to just slow everything down. A simple tip, believe it or not, is to just behaviorally, is to literally just put the fork down in between each bite. Nobody has to know you're doing it. It's no big deal. But what it does is it actually allows your brain and your stomach to communicate in the hormonal way that they do to create appetite suppressant cues, which you don't get if you're shoveling. You don't get it if you're eating quickly. You don't even get it if you're not eating mindfully. If you're doing 12 things while you're eating, which many of us do, your body doesn't even remember that you ate. So, of course, it's not going to stop you when you continue to eat. And so I think we do space out. I think when you go into a social setting, if there's also alcohol involved, while it's a lovely thing for many, and a glass of wine can be a lovely thing, for others, if they have too much, now all of the hunger and satiety signals have been completely overridden. There's nothing that's going to stop you unless it's just physical discomfort or just a sense that other people are looking at you.
We're talking with Jennie Kramer on our program. The book is entitled Overcoming Binge Eating for Dummies. As I mentioned earlier, Jennie is the founder and executive director of Metro Behavioral Health Associates Eating Disorder Treatment Centers, and she is partnered in this book with Marjorie Nolan Cohn. What was that partnership like?
Well, it was delightful. Marjorie is a wonderful dietitian who has worked with me for quite a long time, and we work together in other settings. And she has a couple of other books out, and so her book agent came to us and said, this was a couple of years ago, binge eating is going to be an official diagnosis now through the DSM-5, which we knew. Wiley is looking for another dummies book, and we said, well, binge eating would be the one. I hate that it has the dummies word in it, but certainly it's a book that communicates, and certainly it's a template that people find very helpful. And so, Marjorie, who had already been working with this agent, said, look, we'd love to do that, and so we did, and it was really a labor of love. We hope that it's got some very, very practical tips, practical focus, practical directions. It's not just, pick yourself up by your bootstraps, have a better day. If only if it was that simple. This requires a lot of treatment and focus, because most times when people come to talk about these things, it's because either they've had a health scare or because it's cost them maybe their job, or it's cost them emotionally, it's cost them relationships, they're socially isolated, they're just sick and tired of being sick and tired. So it was wonderful to work with Marjorie, because you need both the nutritional and the psychotherapeutic approach to this.
The idea of healthy eating and the companion idea of a healthy approach to shopping. How important is that?
It's key. Now, food shopping and other shopping are both involved. First of all, what we find overwhelmingly is that people who are binge eaters tend to be binge shoppers. It's a very interesting thing. It makes sense when you stop to think about it. On the other hand, what we also find is that it's very helpful. Marjorie will actually take patients to the grocery store, and she will do a complete session with them on shopping. No one else in the store knows what's happening, but she does it quite discreetly, and it's mind-boggling, because people mostly start to rely on fast food because they really don't know what to buy, and they don't know how to read labels. They don't know how to self-care in this way. Either they were just never shown or they forgot. And so it's a very important thing to have the things in the house that are going to support you and not have the things that are going to tempt you. Now, if only it were that simple. Bingers will always find food to binge on, because mostly either they keep their houses clean of these things and buy it on the way home to have, or they buy just those things, have the binge at home, and then there's no evidence of it anywhere because there's a lot of shame involved. So shopping is a very, very key word. In fact, there are also people who come to us for the first time because there's a legal ramification. They were caught shoplifting. They're so ashamed of buying this amount of food and standing in front of a cashier that they actually shoplift. So that's one of the factors.
When you talk about this healthy approach to shopping, One of the things that often comes up in discussions like the one that we're having today is this idea of the approach that you take when you enter a grocery store or a food store. One of the first things that's said, usually, is the idea you don't go there when you're hungry.
For sure. And you don't go without a shopping list. Because if you leave it to your memory and you leave it to whatever you think you're going to want, you'll buy at least 50% more than what you need. And you're absolutely right not to go when you're hungry, because it's going to misguide what you need. You can't judge what you'll need for the future. You're going to only judge what you want right now in this moment. Also, I'm not one to tell people to restrict foods. Food is a lovely thing, but if you know that you have particular trigger foods that for this moment right now are not things you can resist, don't go down those aisles. There's probably 4 or 5 aisles you could never go down again and still have plenty of food in the house.
The idea of that shopping list in the age in which we live, I find more and more people have broken away from the traditional paper list where they seem to be doing everything on their phones.
It's very interesting you said that. People who are parents and who are sort of running families, they're more likely to have a shopping list, we find, because when their kids are a certain age and the parents get tired of trying to predict what they're going to run out of, they'll post a list on the refrigerator and they say to everybody that can write, listen, when you want something or when you're running out of something, please write it on our master list and then I'll know to go get it. So in certain families, that's likely to happen. But in the majority of cases, people are actually making some notes on their phones to go in and shop. Or they just don't have the time, and so they say, well, I ran out of milk. I better go shopping. And so, again, it's all done in crisis mode. So, yes, it does take a little bit of planning. And, when we work with folks, one of the things they say is, I realize I've neglected this completely. It's not self-shame here. It's about self-care. And that's really what we're teaching people, is how to take care of themselves in a way that they can live with according to their lifestyles. If you have somebody who's working a job from 8 in the morning till 7 at night, you have to account for that in terms of how they spread their food out over the course of the day. If they're going to be having dinner every night at 9 o'clock, then maybe there's a meal reversal that has to take place where a more caloric meal will be a little bit earlier in the day. I mean, there's lots of ways to get around that.
The idea of eating till one is satiated versus eating till one is, and we hear this phrase used an awful lot around the holidays, stuffed.
Right.
And that's something that in many cases is reinforced at a number of different holidays with children.
Yes. Well, listen, many of us are from the Clean Plate Club, where our parents said, you have to finish everything on your plate before you can get up from the table. I mean, they meant well. They really did. And they were probably repeating what was said to them. But the truth is, children actually know when they've had enough. And parents are slow to trust this. Yes, of course, when they're very, very young, you want to keep introducing new foods and see if they'll like them. Children actually have the most efficient ways of knowing when they're full and hungry until we interfere, or until they get into a system where now they're aware of other people, generally like around first grade, second grade. It's very interesting to note, by the way, the average age of the onset of any disordered eating used to be about 15. It's now 9. And that's a very frightening thing, because it means that, again, through exposure to media perhaps, through many, many, many other factors, children are at a much, much younger age already abusing food as a self-soothing technique, but they're also responding to and absorbing a lot of messages that are out there. So there's a lot of preventive work to be done.
When you know someone who's dealing with binge eating disorder, what can you do to be helpful, to be supportive for that person?
Well, the most helpful thing is all the things that you're not going to do. So the first thing you're not going to do is to say to someone, I really think you ought to lose weight. It's really scary. You should lose weight. That feels like it's going to be helpful, but it won't be, because all it does is generate more shame for the person. To be able to approach them at some point, and it depends on your relationship with the person, obviously, but to be able to approach them not in, here's what I think you're doing wrong, you should go fix that, but more about, here's how this affects me, here's why I'm concerned. To be able to say, I love you, and I'm watching a trend, and I'm frightened for you, and it frightens me. I'm wondering, if you're noticing it. Just open that up very, very slowly. If the person says, I don't want to talk about it, or they say, I don't really see a problem, you have to back off. And this is very hard for people to do because they love the person, or if they're frank about it, they're embarrassed by the person. And it's a very difficult thing, but I promise you, the more that you bother them about it, the more that you talk about it, the more they will retreat into the behavior. Now, that's not to say it should be completely ignored, but certainly for an adult, they have to come to this on their own. Otherwise, if they go to treatment for anyone else, it will not work. I can't tell you how many people have any one of several very popular bariatric surgeries simply because they're very ashamed and because the people in their lives and in their world are also ashamed. And so they have the surgeries thinking, this will do it. It'll stop me from myself. My stomach will be the size of a golf ball. I won't be able to eat more than a certain amount. That'll do it. If only. What we find is that in more than 3/4 of cases, within 3 years, people not only gain back everything they lost, which could be a lot of weight, they gain back more. So it means that they didn't get to the core reasons why they must use food as a self-soothing technique. And so that's really at the core of the matter, and someone has to be ready to do that. That's really at the core of it.
What about this idea of, you hear people sometimes talk about the concept of the food police. What about acting in that way? Is that really being helpful for somebody?
No, it never works, ever. This is across the spectrum of all disordered eating. You can imagine a mother comes in with a 15-year-old who's anorexic, and now her daughter is being treated, or her son, and she's been the food police the whole time. Did you eat? Did you have enough? Here's some more. Don't you want some more? Did you eat the snack I sent with you? Did you eat the lunch I sent with you? How much of it did you eat? This does not help. All it does is make the person dig their heels in more, and it creates a lot of conflict between you and your loved one. Food policing is never a technique that we endorse. Now, by the same token, you don't want your family member to think that you're not noticing them, or that you're ignoring them, or that you don't care about them. So again, not at the table, not while you're eating, but at another time to gently be able to say, again, I love you, I'm concerned, I'm watching a trend, I'm wondering if you see it. That's about the best you can do. And then, of course, a person has to be ready to go seek treatment. Now, this is a very controversial point of view, because you can imagine there are people who say, well, so what do you want me to do, wait till they're 400 pounds? Well, guess what? You can tell them at 180, you can tell them at 250, you can tell them at 325. And by the way, not all binge eaters are overweight. But they're only going to seek out help when they are sick and tired of being sick and tired. It's just that simple. And you might feel better if your loved one goes to seek help because you asked them to. It's a false start. It doesn't mean that it's going to actually take hold.
What about weight loss and the attention that is given to that, the amount of attention given to it?
Well, again, everything is context, I think if someone recognizes that they have gained a tremendous amount of weight as a result of using food to self-soothe and eating other than out of physical hunger, the focus still first has to be on really having other techniques to deal with stress other than the abuse of substance, and then learning when you are actually full and actually learning when you're hungry so that you can eat in a more intuitive way. That's the long-term goal. So that's really the most critical part of this, in my view.
We're talking on our program with Jennie Kramer, who is the founder and executive director of Metro Behavioral Health Associates Eating Disorder Treatment Centers. She has talked with us on our program about this information contained in Overcoming Binge Eating for Dummies and sharing an awful lot of information with us. One of the things that you talk about in the book, too, is this idea of a food journal. Why is that so important?
For two reasons. First of all, again, assuming that people really don't have a sense of how much they're eating at any given time or how often they're eating, a food journal allows you to gently and finally be in touch with exactly what you're eating. Now, we're not asking you to calorie count. In fact, that's the last thing we would ever ask you to do. All we're asking you to do is simply write down in the moment what it is you're having. Now, two things happen as a result of that. First of all, you get a sense of what you're really eating, if you're honest about it. Second of all, it can actually alter the eating behavior because when you start to look at this on a list and you see by 5 o'clock, oh my God, I had no idea that I had eaten all that by 5 o'clock, the next day you may actually alter it a bit. Not because you don't want us to see what you're eating and so you're going to eat less and write less, although that could happen. It's more about developing a slow awareness. The second reason to do food journaling is that it gives our nutritionists a much better idea of not only what are the emotional cues, but there are physical cues that make people binge as well, or overeat, certainly. If you're eating, foods that are very sugar-laden, not enough protein, for instance, if you're someone who says, oh, I'm not a breakfast person, I don't eat until 2 o'clock, well, guess what? If you don't eat till 2 o'clock, you are setting yourself up for a binge in the evening or at night because your blood sugar is going crazy from the highs and lows. So from a nutritional point of view, it's critical. From an emotional point of view, it's also critical. Because if you're honest with yourself, all we ask you to do is, so write down what did you have at 10 o'clock. Okay, so I had that. And then to write a little entry about where were you? Were you at a table? Were you in your car? Were you in front of a computer screen? Were you walking to work? And are you hungry? Are you now full? What were you thinking? What are you thinking about? It just slowly starts to create an awareness. Now, you might be thinking, well, this is all well and good, but in our electronic age, who's going to do that? Thankfully, there are some great apps that allow us to have patients do this very quickly and very efficiently. We use apps that do not let the patient calorie count because that is counter to what we're trying to do. But on our end of it, when we receive it, we can see exactly how much they're eating. So it's very helpful.
I didn't ask you earlier in our discussion, some people may be curious about this, about the centers.
Sure. We have two centers. One is in New York City, in Midtown, and the other is in Scarsdale, New York, in Westchester County. And we have a full complement of services, including individual, family, and group therapy, and nutritional counseling, hypnosis, medication management, medical intervention. So it's a lovely center.
And the final point is going to go along the lines of something you just mentioned. This idea of one's, for lack of a better term, support system, which can be family, can be friends. Why is it so important having them also part of this process?
Well, it is and it isn't. It depends, first of all, on how you perceive your relationship with those in your life. Usually people that you choose to have in your life, like partners, friends, are your first line of support. If you are choosing people in your life who you know, for the most part, are not going to be judgmental, they're going to be helpful and gentle, it's critical because they will push you along like a cheerleader. I mean, why do people who are marathon runners do better when there are people all along the route? Even if it's people they don't know, it's because they feel cheered on. So that's an important part of it. The other part of a support community can also be a group. We find that when people are in some kind of support group specifically for this, that they at least have this idea of, oh my God, I'm not crazy. There are other people that think the way I do. It's not just a commiseration session. It's really a way to build community, build hope, be cheerleaders for each other. So that's very important. With family, family is certainly a key part of this, but you have to also evaluate for yourself, prior to this moment, has my family been helpful to me? Is it a relationship that can be built upon, or is it what we sometimes call a toxic relationship? So you have to really evaluate that for yourself.
What are you hoping that those who read this book are going to take away from it?
Well, first of all, we hope that they let the shame go and that they realize that this is something that affects millions of people. Second of all, that there is absolutely hope. It doesn't matter what age you start this journey. So often we have people come in their late 50s and they're like, do I even have a chance? Of course. At any age you do. Obviously, the longer habits have been entrenched, the more challenging it is, but it's never impossible. And hopefully they also get some tips directly from the book so that if they're not ready, willing, or able to seek treatment on their own wherever they live, that they can at least start the journey through the book.
You actually have people ask that question who come to you? They'll say, do I even have a chance?
Yes, all the time.
Wow.
Oh, God, all the time. It's possibly the most frequently asked question because in their minds they think that this is how it's always been and this is how it will always be. It's a very, there's hopelessness that comes along with this. It's also a lack of self-confidence because what they're really asking is, do you think I can do this? Because I don't think I can do this.
It's almost like they're programmed for failure.
Well, if they believe so, yes.
Mm-hmm.
It's funny that you put it that way because one of our jobs is to sort of change the programming a bit. And I mean this in a behavioral way, in an emotional way, and believe it or not, in a neurobiological way, to literally create new neural pathways, new ways of thinking. The brain, we now know, always makes new cells, always learns. We used to think that stopped at a certain age. It does not. So there's always hope for this.
Very interesting discussion. I want to thank you very much for joining us on our program, Overcoming Binge Eating for Dummies. Jennie Kramer talking with us on our program. Jennie's the founder, executive director of Metro Behavioral Health Associates Eating Disorder Treatment Centers, co-author of this book. I mentioned earlier, final question, but I want to throw one final thought your way.
Well, first of all, I want to tell people that there's a wonderful website called BEDA Online, BEDAONLINE.com. It is the Binge Eating Disorder Association. There's lots of wonderful resources there, which I think will be very helpful. And on our website, we also have a lot of resources that might be useful, which is just mbhany.com. So I hope that plus the book will be very helpful.
All right. I promise this is the final question.
Okay.
This is a major issue for a lot of people.
Yeah.
Eating breakfast.
Yes.
So many people, "Oh, I don't have time for it. No, I don't. I'm just not that hungry in the morning. I just grab something maybe 1 or 2 days a week." There's no sense of consistency for a lot of people. How bad is that realistically?
You are hitting on something so important, because I promise you that if people would just add breakfast to their lives as a routine, some of this would actually immediately start to abate, because you've been asleep, presumably, unless you're someone who binges in the middle of the night, which does occur. You've been asleep for anywhere from 5 to 8 or 9 hours. Your body is ready. It has been rejuvenating overnight. It is ready to get fuel. And so it's analogous to making your car go with no fuel in it and hoping that the fumes will be enough. And so if you eat breakfast, and I don't mean, necessarily just some sugar-laden Cinnabon Dunkin' Donuts thing. I'm talking about just have some protein. Have some yogurt and berries. Have a hard-boiled egg and a piece of toast. Whatever you can have, whatever you would like. Have some scrambled eggs. Have a lovely omelet. But have something so that you are not crashing by 1 o'clock or 2 o'clock. You will not know whether you're hungry at that point, because you will be busting with hunger at that moment. You will be famished. That's different than hungry. Busting is different than full. Famished is different than hungry. Hunger is not to be feared. It is your body telling you it's time to eat. But if you wait and wait and wait and wait, and you eat 4 or 5 hours after you're supposed to, now you will eat more quickly, you will eat more voraciously, and you will be hurting your blood sugar, your blood pressure, and you'll not have a sense of what fullness is or hunger.
Jennie, thank you very much. Wonderful discussion. Would you just repeat the 2 websites you mentioned a few moments ago?
The Binge Eating Disorder Association is BEDA Online, BEDAONLINE.com. Our centers are mbhany.com.
Thank you. Certainly good luck with the book, and best wishes, too, with your work.
Thank you so much for having us. Take good care.